All right, this is Tuberculosis by Maximilian D. Jones, or The White Plague. The scripture I chose for this presentation is James chapter 5, verse 14. It starts out with, "Is anyone among you sick?" And then it goes on to urge Christians to seek out wise counsel and elders in the church to pray for them and to heal them and treat them. I thought this picture was relevant because this lady is praying, and it just highlights the importance that community has in prayer on our health. So, signs and symptoms. The original infection with Mycobacterium tuberculosis is asymptomatic. It's fairly easily controlled by the immune system, but not eliminated. So we call this a latent tuberculosis infection. Eventually, it can develop into tuberculosis disease, which is characterized by sweating, weight loss, fever, and pallor. The weight loss is a very notable symptom. As you can see, a lot of the relevant art for tuberculosis that I have in the background here features very skinny people that are struggling with this disease. The causative agent is Mycobacterium tuberculosis. It is a slender, acid-fast, strict aerobe, so it manifests itself in the lungs. Very slow growth, generation time of about 16 hours. And very interesting about this is that it doesn't have a traditional cell wall with peptidoglycan. It has mycolic acids instead. So this makes it difficult to treat with our typical antibiotics. This bacteria is also very well known for evolutionary resistance to drugs. So our drugs can quickly become resistant to our typical treatments, unfortunately. So here's the pathogenesis section. Mycobacterium tuberculosis is inhaled into the lungs. It is then engulfed by a macrophage in our lungs. It then survives and multiplies within the macrophage, which is pretty cool. And then as many Mycobacterium tuberculosis are engulfed by macrophages and survive within, they kind of force the macrophages to all come together and congregate in one area. And this is what's called a granuloma or a tubercle. This granuloma is walled off by the lymphocytes, and a fibrous layer forms around it which calcifies, and this is what we call the GON complex, and this is the characteristic of latent TB. So if these GON complexes won't really present any symptoms, won't affect the host at all, but they will be in your lungs, and at a time when you are immune compromised, the tubercules may burst, and this would release the bacteria, which would activate the tuberculosis, and symptoms would be prevalent at that time. Here's the epidemiology. 13 million Americans are estimated to have latent tuberculosis. Rates drastically increase in less developed areas. There's a respiratory transmission, so through coughing out the bacteria and then someone else breathing that in, things like that. Cases have steadily decreased due to efforts by the World Health Organization. The MAN2 test is a popular test to check to diagnose someone with tuberculosis. They inject a certain protein sequence from tuberculosis into the skin, and they see if a certain immune response occurs and the rigid inflammation is above a certain size, then you're positive for tuberculosis. The MAN2 test is a little outdated though by the AGRAAs, which are the interferon gamma release assays. This is a blood test, and it's much quicker and more specific. Some treatment and prevention. Mostly antibiotic treatment. Combination therapy is necessary due to the very fast mutation rate of this organism. The initial phase of treatment occurs with 4 different drugs. The continuation phase is 2 different drugs. So this may be tailored to the individual person based on the physician's discretion. The first line treatments are rifampin, oceniazid, pyrazinamide, and these are the most effective 3 drugs with the highest therapeutic indexes, so the most safe and the most effective. Unfortunately, many tuberculosis strains are forming resistance to these drugs, and we're kind of scrambling to find some more. X-rays or vaccines are proactive methods we can take to identify tuberculosis in people and manage cases within the population. Yeah. And here are my references. I wanted to include Doc Holliday just because he's my favorite movie character and he has tuberculosis in the movie Tombstone. All right, thank you.